You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. In fact, according to him, he says nobody should be wearing a loose-fitting denture. No more dentures. With us, we have Dr. Field. Dr. Field, welcome to the program.
Thanks for having me, Randy. Appreciate it.
Now, I know that you brought a lot of photos, so we'll try to get to as many of those as possible. But for people that don't know your practice, I guess you have this thing where you do everything right there, and you try to do it on the same day.
Yes.
And you have multiple doctors.
We
so who's the typical patient? What are the different services that you offer?
Well, we're in a pretty dynamic office. So we have multiple doctors, as you were mentioning, and we have patients that come in for whitening. So just the whitening process can make the person look younger. So people come in just to get their look freshened up. We have other people come in that see us that say, hey, we hear about this CAD/CAM system that you guys have where you can make me a crown in one day while I'm waiting. And so, absolutely.
So you have the machine that makes it right there?
The machine right there, yep. And so we have our doctors.
Is it true you can do it in a day?
One day, 1 hour, in fact.
All right.
Our doctors that do that are very specialized, trained for that. Then we have people that come in and say, hey, I want a smile makeover. What are my cosmetic smiling options? And my partner will talk to them about cosmetic veneers and porcelain veneers, which is a great way to make over someone's smile. And then they'll come see me and they'll say, you know what, Dr. Field, I'm missing a tooth, I'm going to be missing a tooth, what are my options there? And it gives me the ability to talk to them about dental implants.
At the top of the show, we said no more dentures.
Correct.
No more traditional dentures.
Right.
You believe that the future of dentistry, like all dentures will be attached to something?
It's now. I mean, beyond it being the future, that's today. My opinion is if someone wakes up in the morning and has to get their teeth out of a glass of water, there's a problem. That should definitely not be the case for my patients and the people that I know.
Now you're in Palo Alto.
Correct.
Affluent area. Are there really people that are, wearing dentures or headed to dentures?
Absolutely. It's a question that I get asked often because it's Silicon Valley. People don't think of it that way. I'm a Warriors fan. We have the Warriors right up the road. Oracle Arena, we can fill it 10 times over with people that are missing a tooth or multiple teeth. Denture wearers, people that are already currently in dentures, same thing. Fill up AT&T Park up in San Francisco. People that are heading to dentures, that's another common problem where they have their teeth but they're about to lose them for whatever reason. Like millions of people in the country and thousands just in my area alone.
Okay, now I have a bunch of questions here, but
yeah.
Same day.
Same day.
So there are certain patients that on the day of the procedure, they walk in with no teeth, and they leave with permanent teeth that don't come in and out, like full arch up and upper and lower.
Isn't it amazing?
Is that common?
In dentistry, no. In my practice, every single day.
Is that right?
Every single day. It's amazing. I mean, it's a great and it's funny because if you think of yourself as a patient, say you don't have teeth, you're in dentures, you don't want to keep staying in dentures. If you're going to go through a procedure to get teeth, you want teeth. You don't want to have to wait months to get it. So the techniques that I use, the materials that I use, the procedures that we do, we can give the teeth that same day. So they come in, they walk out, they're not coming in and out anymore. That jar that they put it in at nighttime gets thrown away. It's done.
Now, if dental implants are so good,
yeah,
and there's so many of these denture wearers, as you say, that are either headed dentures, why aren't they all doing it?
Interesting.
What's your take?
Here's what I've found. When patients are going through this process, so they've had a lifetime of dentistry and they've gone through and they've had fillings and crowns and root canals, then something goes wrong and they lose the tooth and they carry all this baggage with them. They've had all of these negative experiences. Then they get to the point where they're in dentures, they're out of the system. They're done at that point. So they're stopped seeing a dentist. They're not aware of any options that are going on. They're not plugged in anymore at what's happening. And that's one of the great things that I like to do.
So they don't know their options.
They don't know their options. They don't know that, hey, I don't have to live my life this way. They really don't.
Yeah, but isn't it true? If you've been in like wearing a denture for 20 years, you don't have enough bone to get this procedure?
I get asked that question almost every day. So patients come in and say, hey, I've heard about this implant thing and I heard I can get teeth attached to my bone, but I've been told I don't have enough bone. And I think in that practice, maybe that clinician, their level of training, that's true. I haven't once in over a decade said that to a patient. I mean it. When they come in to see me, I want to give them teeth. I want to make sure we can make it happen. I have advanced techniques using build boning technology, things to give them the ability to have something fixed permanently in their mouth. I had a patient come see me. I was his 4th consultation. Everywhere he went before, they said, look, you don't have the bone. It's not going to work for you. We're going to have to put you in a denture. You're going to have to spend months rehabbing from surgeries, etc. And he told me straight to my face, said, doctor, unless you can tell me there's a way of doing this without a denture, I'm walking out the door and I'm going somewhere else. I was able to look him in the eye and say, I can absolutely do this for you without having a denture. That is an option for you and I can make it work. Now the guy has teeth that don't come in and out. He can eat whatever he wants. He can smile without reservation. He can work. He can be social. Everything that he wants to do, how he lives his life, is not hindered by his oral condition. Back to your original question, why doesn't everybody do this? There are patients that come in and say, look, I'm just too old. I'm just too old to have this done. The fact of the matter is 1 in 4 Americans are living into their hundreds now.
Well, how old can you be to do this?
I have patients in their 90s doing this. I had a sweet lady, beautiful lady, 91 years old. And she said, look, I just started my 90s. I got a long way to go. My teeth are driving me crazy. I want to be able to eat. I want to be able to chew. I want to make sure that I'm not having to worry about any caretakers, losing my denture. What are my options? We did implants for her, gave her a fixed solution, something that wasn't coming in and out. Beautiful smile. She comes back in, she says, Dr. Field, I can eat salad now. I couldn't eat salad before. I love salad. Thrilled. I mean, literally tears coming out of her eyes with this experience. That was 5 years ago. She's still doing great. She comes by, she has her daughter bring her in just to say hello. I mean, teeth are doing fine, doesn't need anything. She just wants to come in and say hello to me.
So 90-year-olds, they're not, statistically, they're not more likely to fall out or have an issue.
Absolutely not, and beyond just the age, I get asked that. Well, what about osteoporosis? Because sometimes that's linked to the age.
Yeah, good question.
It's not. We have all the data to support it. In fact, when we have osteoporosis or something called osteopenia, which is like the beginning stages of that, having implants in there actually helps strengthen and stabilize that bone. It's a good thing to have in there.
Okay, good. Now you brought photos. What are we looking at?
I did. Okay. So you asked me earlier, what type of patients do I see in my practice? Again, I'm in Silicon Valley, fairly affluent area, but the reality of it, the patients that I see range from professional dog walker to CEOs of Fortune 500 companies. So these types of maladies have no bias. They don't choose certain people. It covers the whole spectrum. This first guy I'm going to show you, this is my professional dog walker.
Okay.
He came in to see me. He said, Dr. Field, my teeth hurt. I can't eat. I can't chew. I know I have a problem. I've been putting this off for years and years and years. He was good friends, or is good friends, with another patient of mine that went through this procedure, heard about his experience. He said, look, I've been avoiding this for more than a decade because I knew it was going to be miserable. His friend told him, actually, it was a great experience. You should go see Dr. Field.
All right.
So here he is. He comes in and he starts telling me, okay, I don't like the look of my teeth, but that's not my major concern. I'm an older guy. I'm not too worried about having the Hollywood smile. I just want to be able to eat my food.
Okay.
I want to be able to not have my teeth wiggle. I want to not have pain when I bite. We looked at all his different options. We went through the different scenarios of what he could do, and he told me, I'm not going to do a denture, and that's the direction he was heading. I don't want anything that's coming in and out.
So those teeth had to come out?
They had to come out.
All right.
Yep, exactly. There was decay, there was root, gum disease, all those maladies that he was dealing with for more than a decade, really. So in one afternoon, Randy, he leaves with a brand new smile, attached permanently to those implants. Beautiful, long-lasting, durable. He's able to eat what he wants. He's comfortable. He's smiling. And if you look at the after picture, so this is interesting. Again, he said to me, I'm not interested in cosmetic improvement. That's not my major concern. When he saw his smile, it was almost like it was jumping off of his face. It was incredible. Okay. And he said, okay, I know I told you I didn't care about the cosmetics, but this is amazing. I'm so thrilled with this.
Now, how soon can they eat after it's all done?
Right away. Right out of the gate, I tell my patients, take it easy. Don't go biting into the sandwich quite yet. Stay with softer foods. But right away, they're eating.
Okay.
Absolutely. Once we had a little bit of healing, then they're eating whatever they want. I have patients, so this guy in particular, he loves peanut brittle.
Okay.
Okay. And so that can, for a dentist.
Everybody likes peanut brittle.
Everyone likes peanut brittle. But as a dentist, we get a little concerned about peanut brittle, right? And so after we were done with this, the restoration that we gave him, it was so strong. I told him, go eat your peanut brittle. Enjoy it. Not going to cause any problems.
So they could bite like a raw carrot, the front teeth?
Yeah, raw carrots, apples, anything. Broccoli, everything they want to eat, they can eat. I don't recommend eating rocks, but any food item works just fine.
Okay. Yeah. And how long? So they'll last as long as you do.
They better.
And you just take care of them. You see the dentist like every 4 or 6 months or something?
Exactly. And what I tell my patients, so these will not get cavities. You're not going to have any more decay issues. But we still worry about gums. Gum health is important, even with implants. And so regular cleanings, good home care, making sure you're taking care of these things properly, that's still an important thing. Let me show you this next patient.
All right.
So this is a lady that came into our practice. She is the daughter of a dentist and had past history with smoking and other health issues. And like most women, said, look, I don't take care of myself. I take care of everybody else around me. I'm the last one that gets attention. It got to the point with her teeth where things were falling out, literally, of her mouth. And it became a real emotional thing for her. And she said, again, almost in tears in that first visit, she, as a daughter of a dentist, and she admitted to me, she's like, I know better. I know better than this. I know better than to neglect my teeth like this. I was able to tell her, you're not alone.
All right.
Patients I see every day have that same story, and it's normal. We have that in our lives. Lives happen, things happen. Sometimes our health gets pushed to the back burner, but now it was her turn. It was her turn to take care of herself.
So the teeth I'm looking at on the before, those had to come out.
Yeah, so she actually...
And she would have had a denture.
Exactly. So she had cosmetic work done at some point along the way to help enhance her smile. The problem was not necessarily the teeth, it was the foundation. So she had pretty advanced gum disease. And so the teeth were wiggly, there was infection, all of those things happening.
What if you have bad gums? Are you still able to do this?
Absolutely. Yeah. Okay. The majority of the bad gum issues are caused by the teeth. And so if the teeth are not salvageable because of the gum situation, we can still transition to implants.
So when you extract the teeth, the gums get healthy?
Yeah, because the source of the infection, again, we're removing that with the teeth. We're cleaning everything out. We're giving essentially a brand new start, a new life.
So her dad's a dentist.
Her dad's a dentist.
Probably doesn't do dental implants, sends them to you.
Does not, right.
Okay, nice. And then so what'd you do for her?
So we went through the process, same thing as I mentioned before, where no way on God's green earth am I wearing a denture. That's what her words out of her mouth. We had to find a solution for her, and that's what we did. So she came in, we did the surgery. She had cosmetic work done by my partner. She left that same afternoon with teeth attached. Nothing removable, everything fixated in her mouth. She was able to eat, speak, live her life.
So they don't come out?
They don't come out.
Now, sedation.
Yes.
Because you're big on sedation. So during the procedure, you don't feel anything.
Right. And let me give you a little background on my belief with sedation.
All right.
I'm a horrible patient, Randy. So if I ever get in a dental chair, I'm a wreck. Okay.
Really?
So because of that, in my experiences, I did 2 years of extra training to do IV sedation for my patients. I want my patients to have a great experience. I want it to be the best experience they've ever had in a dental chair. And so the IV sedation is a beautiful tool for that. We come in, we start the IV, the patients are drifting in and out of sleep, they're feeling great, it's over, they don't even know it, they don't even remember anything about it. And the other really great thing about IV sedation is the recovery process. So via the IV, the medications that we're able to use help minimize inflammation. We have very little swelling, very little bruising, very little discomfort.
It's safe.
Absolutely. And let me give you a little differentiation on this. So there's something called general anesthesia where you're not breathing, you're intubated. That's a little bit more
tube in your
involved.
mouth.
A tube in your mouth,
Okay.
yeah. This is called IV conscious sedation. So you're still breathing on your own. You have all your protective reflexes. You're hooked up to all the hospital-grade monitoring equipment. But what I found too is patients that maybe have high blood pressure or have anxiety, this actually creates a safer environment for them because their body's relaxed. They're under control. It's much healthier.
So they wake up and they have a beautiful teeth.
Beautiful teeth. It's like a rebirth, really, because they're waking up, they left one way, they come back, beautiful smile, strong teeth.
You're convinced, or not convinced, we've talked on the phone, that you say that this really is life-changing.
Yeah.
And you believe that?
I do.
Because I always say it's just teeth.
It is, yeah. And you think, hey, I'm a dentist, I'm biased, right?
Yeah.
So
that's why it doesn't surprise me to hear you say that.
Right.
The teeth are important.
Of course I'm going to say that. Interesting enough, a couple years ago, there was a study done of the thousands of Americans, and they were asked to identify the most important physical characteristic of another person. The vast majority said the person's smile.
All right.
These aren't dentists, these are average Americans, right? So this is an important thing. And beyond the aesthetics and having a beautiful smile and the confidence, a lot of my patients say, look, I just want to be healthy. I want to be able to eat what I want to eat.
All right.
I want to, we have our baby boomers are very active. I have baby boomers that are skydiving. They don't want to skydive with their denture falling out of their mouth while they're, 10,000 feet in the air. right? And this is the patients that I'm seeing.
So because there's a lot of people with money but with bad teeth. Is it the fear of the dentist that's keeping them from doing it?
Absolutely, and that's where, again, this IV sedation...
Nobody wants to go to the dentist.
No, it's not the top of everyone's to-do list, let's be honest. But that's where the IV sedation comes into play, because I'm the same way. If I could put off dental treatment, I would, but I know better, obviously. And for patients like that, they come in, literally, I haven't been to a dentist for decades. I'm scared to death. I have patients that almost have panic attacks walking in the door. Fortunately, I have a fantastic team. They make them feel comfortable instantly. Create a good experience for them. But we're able to provide the care that they need in such a way that it's very safe, very comfortable.
Okay, good.
Let's talk about another case.
All right.
Another patient of mine. So this is a guy that came in to see me. He had partial dentures already. So he had some teeth remaining, and then the rest were the partial dentures, which were attached to the remaining teeth and still come in and out. And he said to me, same story here almost every day. Look, doc, I've been in these partial dentures for a long time. I've dealt with it just because I had to. I've heard about these dental implants. Can they work for me?
All right.
What do? We start by taking a look at his jawbone. We do our 3D scans, get the imaging. It's all part of our consultation visit. And I say, absolutely, this is an option for you. Because, again, I have yet to say to a patient that implants are not an option for them. We go through the process of what implants can do to change his life. And he said, in his case, cosmetics was a concern. He told me, he's like, I don't like the way these partial dentures look. I don't like the metal bars that are hanging on my teeth to hold things together. So I want to eat better. I want to have a healthy smile, but I want it to look nicer too.
Yeah.
And so if you look at that before picture, you can see, I mean, he has a hard time smiling. You can tell he doesn't even open all the way when he smiles because he's trying to hide the metal bars that are in there. And then now look at our after photo.
He looks like a different guy. He looks younger.
And he said to me, my coworkers think I had a facelift.
I could see that.
Right?
His eyes look happier. He looks good.
Totally different. His wife, unbelievably thrilled. And it was great. His wife was very involved in the process. She was there at the appointments. She was actually giving more feedback on the aesthetics than he was. And he would kind of roll his eyes and I'd say, look, she's got to look at you. So, she wants to make sure it looks good. That was life-changing for him. It looks like a whole new man. The smile is bigger. And here's the part with this that's really important. So even when my patients don't come in wanting the cosmetic improvements, for me, that's a big deal. There's an artistry.
To make them look good.
Absolutely. Okay. I don't want it to look like a denture. I mean, that's the whole idea. We're trying to get rid of the denture look. I want them to look like beautiful, natural teeth. If someone says, oh, that's a nice-looking implant crown or a nice-looking denture bridge, I've failed. I want them to say, that's a beautiful smile. So we take painstaking steps to make sure that every artistic detail is followed. We're making sure we're getting the right curvature, right lengths. We're showing enough teeth. All of these details are vitally important. And these steps are often skipped. And it's a travesty because you spend the money, you go through the process, in the end, it still looks like a denture.
So we have time for more photos.
Great.
What else are we looking at?
Okay, this is a great guy. All right, he had cosmetic work done years ago by my partner, actually. Beautiful smile, everything was great. Unfortunately, he also fell in the category busy executive, didn't really take care of himself. He would kind of disappear for years at a time. And then finally he came in, and part of the cosmetic work that he had were bridges. And at the time, he's like, look, I don't want implants, I'll just do the bridges. And bridges are fine, they'll last, 7 or 8 years, and that's kind of where he was. And he walked into my office holding his front teeth. And he put them down on a tray. He said, okay, Dr. Field, fix me. And so off we went. And so we had this conversation. I said, okay, look, we can go through a few different options. We can do a denture for you. We can do a few implants and something that kind of snaps in and out on a denture. Or we can do kind of like what you had before, where it's permanently attached to your teeth. Nothing's coming in and out. Eat, chew, whatever you want.
Okay.
Obviously, he's going to take that option. And so he said, let's go. We went through our steps, went through the process. We did the implant placement. He left that afternoon with a brand new smile. So no more of this bridge coming in and out, which again, for a busy executive is problematic, to say the least. He was able to go home that day, eat dinner, enjoy his life again.
Now you do a lot of, because some of these teeth look like veneers.
Yeah.
So what are they made out of? Because I guess there's two ways to do it. Some people are doing plastic, some people, what do you do?
So we have our own lab that we work with that's able to help us develop these cases, and I can work literally I'm spending almost as much time over with our lab as I am chairside with my patients.
Okay.
And so when we go through these cases, there are different material options, and I think that's important for people to know. And what's traditionally been done is they'll use some type of bar that attaches the implants, and then they'll slap denture teeth on top of that. That's what we call a hybrid denture.
Like with plastic.
Well, plastic.
All right.
Yeah, those are, I say they look great on day 1. On day 100, not so much. So the difference is with that material is it just wears very quickly, teeth can break off, it just is not very resilient. It's an option for people, sometimes they choose it because it's lower cost, but I really recommend not going down that road. What we use in our office with our laboratory is a material called zirconium. So it's a solid material, it's a ceramic-based material. You can drive your car over this material, Randy, and it won't break. Okay. I mean, it's amazing stuff. All right. We have, in fact, there's a 5-year study just released on this. 5 years, thousands of arches done with this zirconium material. 0 failures. 0.
So they don't break. Zirconia doesn't break.
So
you can eat whatever you want.
Eat whatever you want. And the other side to it, if it's strong, I mean, you could put metal in the mouth and it's not going to break, but it's not going to look nice. The other nice thing with the zirconium is we can make it look beautiful, look like natural teeth. We can give the same type of coloring, the translucencies. All of those characteristics that we see in natural teeth can be reproduced with our lab using this zirconium material.
So even if you have bad gums, like gum disease,
yeah,
your gums are still good enough to get the procedure?
Absolutely.
Okay, good.
Absolutely. And it's interesting because people will come in and say, look, my teeth are good, but I just have gum problems. I'm just trying to use mouth rinse to get rid of it. You can't mouth rinse gum disease away. And so usually there's a root cause, there's something underneath that needs to be dealt with. Here's another patient.
All right.
Okay, it's a similar theme. Again, I hear it every single day in my practice. I know he had a same thing, an old bridge.
His teeth look pretty good.
They do. He had an old bridge. It was about a 20-year-old bridge, so he'd held on to it longer than normal. But underneath was a different story. So the teeth were rotted through. There was gum disease. There was other issues, and he knew he had to lose his teeth. And he'd seen many dentists before, and they told him, "Look, you got to lose your teeth." So he comes to me and starts asking for my options. And again, every place that he'd been, he said, "You're going to need a denture. You're going to have to wear it for a few months while everything's healing, and then we can transition to implants." I don't know about you, but I don't want to wear a denture. And I treat my patients the way I'd want to be treated. And so I told him, absolutely we can do this. We can do it in such a way that after I do the surgery, you leave with teeth attached. There's nothing coming in and out. You're able to eat and chew. And for him, he was on a weight loss plan. He was eating a lot of salads. And so he said, I have to be able to eat my salads. Otherwise, I'm going to be in trouble with this weight loss plan I'm in. He's in front of people all day, so health is an important thing to him. So I had to promise him he could eat salad. That was the deal breaker. I did. He came in, he said, look, I'm eating salads, I'm eating whatever I want. And not only that, the smile was amazing.
They look real. I mean, they look like real teeth.
Absolutely. And the big thing you'll notice, it doesn't look like a denture. It looks like actually individual teeth. Dentures sometimes just, and even bridges, just look like a block. These are individual teeth. They look like they could be exactly what they should be.
Like there's curves to these I'm looking at.
We have the curvature, we have the lengths, we have what we call line angles. All the little nuances that make a tooth look like a tooth, we build into this material.
Okay, good. Now if a denture wearer walks in, what are their options as far as dental implants?
So when a denture wearer comes into my office, we talk about, essentially there are 3 options that we'll go through. The first option we could talk about just placing 2 implants in, and then we make these little attachments that go onto the denture, and it kind of snaps in and out. And it's better than a denture. It's kind of a step up from that. But there's still some rocking, and those little connectors wear out fairly quickly, so there's the maintenance involved. So we can offer 4 implants, and they get a full arch of teeth, and again, it's something that's coming in and out. The next option up is teeth that don't come in and out. That's what people want. And commonly, we place 4 implants, and it supports the full arch of teeth, and that's pretty good. In my practice, I actually use 6 implants. I don't charge more for the extra implants, but I believe in giving patients the very best option that's available.
All right.
So we place the 6 implants, and they have a bridge, a complement of teeth that doesn't come in and out. They eat whatever they want, and it can last a lifetime. And what my denture patients really love with this process is we get rid of that covering of the roof of their mouth. There are taste buds in the roof of our mouth. A common complaint I have from denture wearers is I can't taste my food the same. The texture's not the same. It's not as enjoyable in the eating experience. Once we remove that part, the palate part of these dentures, it's a whole new world. Food tastes better. They're able to feel what they're eating. They're able to feel temperature. It creates a whole different experience for them. And honestly, for some of my patients, it can get emotional. Even me trying to think about what that would be like and then transitioning in one day to not having that, it's an emotional experience.
So it really changes their life.
It does. And it's the simple things. And I've seen patients that come back in and my hygienists are doing a great job of cleaning things and make sure they're healthy, and they're reviewing, what their lifestyle is like. And one of my patients said to my hygienist, I used to, before I lost my teeth, I had a bad habit of chewing ice. And he said, I'm back into that habit again. And my hygienist initially said, well, you really shouldn't do that. But he'd been doing it for years. And again, this material is so strong, it was holding up great to that. I still told him not to do it.
So you could eat ice or whatever you want.
Yeah, but I say, be smart about it. Ice is probably not the best thing to chew with natural teeth, certainly not with these either, but he'd been doing it and there have been no effects. So.
Okay, good. So we're running out of time. But okay, so the two categories, people that are headed to dentures.
Yes.
They can come in, if they have to, get extractions, and in one day get a full arch of teeth that don't come in and out.
Correct.
And walk out and
Yes.
eat whatever they want. And then there's the denture crowd, right? And they're skeptical,
Right.
you say. In fact, they come in and still say, really?
Yeah.
They're skeptical.
They are. And again, because a lot of them, they've just been out of the system. They don't realize what options are available for them. And sometimes they'll say, you know what, my denture is good enough. And that's kind of the conversation we have for a year or so. And then maybe their spouse gets involved or someone else starts talking about it. And they start to realize that they're worth the investment.
Okay.
And they're worth this change.
But I know denture wearers, a couple of them. They never complain.
Well, they're not going to complain to you. You're not a dentist, Randy. So
Yeah, okay.
Of course, I'm the one that hears
So you're
these
saying
stories.
there's no such thing as a happy denture wearer as far
Never
as...
met one.
Okay.
Never met one. I've only met denture wearers that have basically succumbed to their circumstance, is the way I describe it.
So they're just have adapted.
They've adapted. Yeah, humans adapt very well. They adapt to a very difficult situation.
Okay. So no more dentures. You're going to wipe out dentures and
Wipe them out. I'm telling you, if you wake up in the morning, you got to take your teeth out of a glass of water, there's a problem. Or if you're insecure about your denture, a lot of our baby boomers are dating again, and they want to be able to feel comfortable in social situations. They want to be able to eat what they want to eat, do the activities they want to do. Come see me.
We are out of time, but I want to mention Medicare, Medicaid does not cover dental implants. Even the best insurance is only going to cover a very small part.
Which is correct, but we have a dedicated team that will work with your insurance. So we'll maximize whatever insurance coverage you get for this.
All right.
We'll make sure you get it. And beyond that, we even have financing options available. We have a team that's dedicated to make this possible for our patients. Not every patient walks in and says, hey, I'm ready to put cash and pay. They want to make it work for them
Are
financially.
a lot of people financing this?
Absolutely. Yeah, absolutely. And we have great programs to help them. It's so great for them.
Is this one of those things where they say, I should have done this years ago?
That's funny you say that. I hear that almost every time. I've never had a patient say to me, oh, I wish I wouldn't have done this sooner.
They all say this.
They all, every time. Yeah, absolutely.
Okay, good. Well, I appreciate your enthusiasm,
Yeah.
and thank you for coming on the show. And you guys do free consultations.
Free consultations.
And so just, it all starts with going in
That's
first.
right. Please come in. You just got to talk to me.
All right, great. Thanks for coming on the
Thank you,
program.
Randy. Appreciate it.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.